I'm Dr. Dorsa from Performance Chiropractic. Today we're going to take care of a patient who has had neck pain for the last week due to some postural issues at work. If you'd like to just see the adjusting or the cracking stuff, I've linked a comment below with a timestamp so you can skip forward to that. If you'd like to see the whole thing, go ahead and stay with me. So you're having some neck stuff going on?
Yeah, I don't know. It wasn't like a specific injury. Nothing happened. I was just at work, and I think it was the ergonomics of this terrible desk.
Okay.
By the end of the day, like my neck was really stiff, and it almost feels like arthritic. Like I can't extend it past here.
Okay. Does it kind of pinch?
It pinches, and it feels like there's like a physical limitation.
Okay.
And then like there's certain other, like I can't extend past here. Once I do this, it's not as much of like the like feeling like there's a physical limitation. It's just like all the muscles get tight and they start to pull.
Okay.
But even like sometimes when I swallow, I'll feel it in that same spot.
Okay. And if you try to bring your chin down to your chest, that feels more like a muscular pull.
This isn't bad. Like upper neck is fine, but then like if I try and go lower, there's a couple spots where it starts to just stretch. Like I get muscle tension.
Okay.
Pain.
And then if you look all the way to your left.
That's fine.
Okay. And then all the way to the right.
That's fine.
And then if you take the left ear to your left shoulder.
That I can't do.
Okay. And then same thing to the right.
Yeah. It almost, I don't know, like, you know when you have an adjustment that like doesn't really adjust and you end up like,
yeah,
that's almost what it feels like when I go to the sides. It's like sore from like where you couldn't get an adjustment.
Okay, gotcha. And no radicular symptoms, not going on or anything like that. So looking straight ahead, I'm going to push onto the top of the head. Does that recreate anything?
No.
And then if you look to your left, look up slightly, same thing, pushing down. Middle half is okay, same thing to the right, and then up. Okay.
A little bit.
Where do you feel that?
Same spot, like.
Okay. Is that more so on the left?
I mean, it maybe a little bit more on the left, like right here.
Okay. And then looking straight ahead, taking that to the side, if I press down.
No.
Same thing over here. Feels okay?
It feels like a good stretch.
Okay. And then if I pull up here.
Also feels like a good stretch.
Cool. I'm going to be pretty gentle with the adjustments.
Yeah, I'm a little nervous.
I'm going to test and retest and make sure that it's safe to do it. And me just pressing in through here.
And that first spot you did?
Kind of like into that.
I mean, I think it was mostly just because it was putting that extension back. Yeah. Those are tense, but not.
That feels okay there.
Yeah, it just feels
so
like.
It's mainly kind of that lower spot.
Yeah.
Okay, so we're going to probably get a CT adjustment. So if you relax that, I just kind of fall into my hands and I take you here. Any pain with that?
Not yet.
Okay. And then if you relax here. Any pain with that extension?
No.
Okay. And then if we're relaxed and I take you here. And that's okay?
Yeah.
Okay. Cool. So me pressing in there, that feels okay?
Yeah.
Okay. So a little push right here. Nice and relaxed right there. You okay?
Yeah.
Just a little bit of apprehension.
Yeah.
Okay. And felt okay though?
Yeah.
Okay. And then same thing, nice and relaxed here.
Ooh.
And then I'm going to release these guys here, and then we'll kind of move into kind of that lower spot that you're talking about. When I press in through here, any tenderness with that?
No.
Okay. And then if I take the head to the side here, are you doing okay with that?
Yep.
Okay. So we're going to do a little push right there. Good. Alright. If you bring your chin to your chest, any pain with that?
No.
Okay. Big breath in, let that all the way out. Good. And then let's flip. go face down one more time. You're stiff there. So a little push right here. Big breath in. And let the whole way out. Good. That's pretty much as much pressure as I feel comfortable putting in. Let's retest that stuff and then we'll get into some soft tissue.
Okay.
So go ahead and sit on up. And then we'll do a retest. Hello. Cool. Can you go ahead and bring your chin down to your chest? And does that feel okay? Just holding it there?
Yeah.
Okay.
I never really understood tape, but I mean, it works. I just don't know why.
Yeah, it's kind of, you know, if it works, it works. If it doesn't, it's just a piece of tape.
Yeah,
It's
right.
never an end all be all, but especially for postural stuff, I like it. For neck stuff, for whatever reason, it has really been helpful for me. You know, when I was in school studying, that was always one thing that would kind of work as a postural reminder. Does that feel okay?
Yeah.
Okay. In the next clip, I go back to an adjustment that I couldn't do prior to the soft tissue work, and then we get into some extremity adjustments that we kind of just did for fun. Okay, so me pressing in there, is that okay?
Yep.
Okay. And that feels okay there?
Yep. Ooh, yeah.
Got it. All right, go ahead and sit on up and let's recheck that. How does that feel?
Better.
You feel like we got that spot?
I mean, translation, like extreme translation is still pinches, but it's a
Way
lot
better.
more than I had.
So if you came in here at 0% and 100% is completely better, where would you say you're at right now?
I'm not like 100%, not completely back to normal, but I'm definitely better. It's 75%.
Cool, so a little bit more motion.
Yeah, definitely got more motion.
If all we do is adjust and send you on your way, it's probably going to start to come back a little bit. So especially today, right after the adjustment, we're going to work on some neck circles.
Start by squeezing your chin down to your chest as long as there's no pain there. Stretch is okay if it's in the back, but if it's in the front or into that same side, that's what we're going to try to avoid. Take the chin all the way over to this right shoulder. That feels good. Take the chin up over the shoulder, and then up towards the sky. Freeze right there. Try to elongate the neck as you kind of hinge backwards, so we feel kind of these spots here. Big rainbow over to the left side. Squeezing as much rotation as you can there, and then send that down to your chest.
Good. And that way we can get all of the articulations in there. Did that feel okay?
Yeah.
No pinching, pain, tightness? Okay. All right, let's go ahead and take the arm like this. I'm going to do a little push. And then same thing here. Cool.
Ooh.
There you go. Ooh.
That was the pop.
There you go.
Yes.
If you made it to the end, thank you so much for watching. Please hit that subscribe button if you'd like to see more of these videos. I post them weekly, and I'd love to hear your feedback in the comments below. If there's anything you'd like to see less of or anything you'd like to see more of, I'm always trying to improve my videos.